Hi everybody, it's Menopause Barbie here, and today I have with me Payal Banik, Dr. Payal Banik, and she is a doctor of osteopathic medicine. And you know that I like to present everything to you. I want you to know all of the resources and all of the professionals that are there to help you manage your menopause your way. And I think the best way for you to know exactly what's available is to bring everything to you. So Dr. Banik has volunteered to help me help you in managing your menopause your way. So thank you, Dr. Banik. We really appreciate your being here.
Thanks for having me.
You're welcome. And she's going to tell us all about what she does for a living. So I have a question. First question is, Doctor of Osteopathic Medicine. Now, we've all heard that, D-O, or osteopath, but what does that mean? What is a DO?
A DO is, simply put, a licensed physician in the United States. So we have the same training as an MD would have. We go to 4 years of medical school, and we also learn how to do additional treatments with our hands. So we diagnose and treat the body with our hands.
So you go to 4 years of medical school and you learn more than the MDs do.
Actually, yes.
And then after the 4 years of medical school, is there more? Is there residency, internship, other kinds of training after that?
Yes, we can go into any specialty that an MD can go into. So primary care, family medicine, internal medicine, OB. You can also go into specialties such as orthopedics or dermatology or surgery. So really anything. Minimum
That's
is
pretty cool.
Yeah, minimum is 3 years residency, and if you specialize all the way up to cardiology and cardiovascular surgery, then that's up to 8-9 years.
And that's just how it is for MDs too.
Right,
it's the same difference in turning in terms of how long it takes you to get there. So, so when you go through your DO training, how does it differ from medical training other than the manipulation that you learn?
So the osteopathic philosophy that's ingrained in us from the very beginning is that we are body, mind, and spirit, where the body is a unit. Everything functions together. You know, when you're in medical school, you learn everything in systems.
Yep,
so
we do.
the heart is a system, the lungs are a system, the GI system, the gut.
Gastrointestinal gut.
Right, your nervous system, your brain is a system. So that's how we learn things, because it's so complicated. But in truth, everything functions together.
Sure.
And
of course it
so
does.
that, and then our bodies have self-healing properties. So when you get cut, you don't stay cut.
Right.
And when you break a bone, we might, immobilize it so it doesn't move, but your body's doing the healing itself. And so we, that's a core osteopathic principle during our treatments, is that we want to use our body's natural healing properties.
Okay. And when you say natural healing properties, does that fall into the realm of preventive medicine more than curative medicine?
It can be both.
Okay.
A lot of times when you're trying to prevent something, so I have many patients who come to me, and as a backstory, they had chronic sinus infections, and they're coming to me for something else, like neck pain or back pain or whatever, and I'm treating the entire body, the entire system, and several months or a year down the line, I might see them and they might say, oh, I haven't had a sinus infection for a whole year now. And that's part of the prevention that's happening. But when you're thinking of prevention, it's kind of like looking back, right? And it's not like, well, I'm seeing an immediate result, which is what our healthcare system is very focused on. Right. Our osteopathic founder, he said anybody can find disease, and it's much harder to look for the health.
Absolutely.
And that's another core osteopathic principle, is I want to find the health within my patients.
Yeah, well, that makes sense. And so you specialize in osteopathic manipulation.
Yes.
What is osteopathic manipulation? I mean, I think the word manipulation is one everyone has heard, but I think the majority of people associate the word manipulation with chiropractic treatments. So what is an osteopathic manipulative treatment?
So there's a huge range. It's a form of manual medicine, and chiropractic is one way to treat the body. Most commonly, people go to chiropractors, and they're very known for their popping and cracking.
Yeah. I had those treatments, and I'm like, what happened?
And chiropractors are specialists in the bones themselves, right? And the spinal column and how the nervous system relates to the spinal column. Osteopaths, again, like to focus on everything. So we're a layer system, right? So if you think of the arm, very on the surface there's the skin,
right?
And underneath it there's the fat, and underneath that there's muscle, and underneath that there's bone, right? And there's arteries, and there's blood vessels, organs, and we're a body of fluid, right? 70% of us is fluid, and so how these things relate and connect to each other, the osteopathic treatment looks at all of these elements. And so we start learning how to palpate or touch these different elements in our training in medical school. And then, we get deeper and deeper, and I specialized in that. So I'm not only focusing on the bones and the relationships there. I'm looking at the entire system and how it relates.
So is osteopathic manipulation one of the specialties, just like pediatrics or family practice would be?
Yes, so the specialty is called neuromusculoskeletal medicine and osteopathic manipulative medicine.
And does osteopathic manipulative medicine work for all sorts of medical problems? I mean, you said something about sinus infections, sinus drainage, and I'm thinking, that's amazing. Because when I think of manipulative treatments and I think of the musculoskeletal system, I certainly don't think of sinuses. So your treatments can take care of more than just musculoskeletal issues like the chiropractic treatments can. So someone could have pelvic pain from their pelvic organs, soft tissues, and you have treatments for that. And is it all with just your hands?
Mostly I use my hands. On occasion, I'll use another instrument. It's called the Fulford percussor. So there was an osteopath many, many years ago, and back in the day, they had all the MDs go off to war, and the osteopaths were in the States taking care of patients, and he had a line out the door from sunup to sundown, and he said there has to be a more efficient way that I can treat people. And so he created this percussor, and that allowed him to treat deeper into the tissues and be more efficient and quicker with his treatments. And so sometimes I use that as well.
Wow, I mean, that's interesting. We use surgical instruments in medicine, traditional medicine, MD medicine. We should all these other things, and we hardly we use our hands as diagnostic tools, but not as curative tools as much. I mean, that's probably the big distinction. So
I would like to say that not all DOs do osteopathic manipulation.
Yes, that's true.
Even though we all learn it in medical school, it's one of those things that if you don't use it, you lose it. So if you're not continually practicing, continuing to get better, then...
And does an osteopathic doctor work in the same fashion that a medical doctor does with regard to things like payment and insurance and things like that? If a patient wants to come to a doctor of osteopathic medicine, is it covered by insurance, or do they pay out of pocket? How does that work?
Osteopathic manipulative medicine is a covered service. However, it depends on where you go to. So some places accept insurance, and my practice we don't. So I give a piece of paper for you to file with your insurance company, and it just depends on what insurance you have and the agreement and all that.
Well, that makes sense. That's the way a lot of doctors' offices are. I mean, that's the way everything is becoming in medicine these days. So do you see a lot of women in the menopausal age range for various symptoms that are due to menopause, whether or not they know that they're due to menopause? Because the truth is, menopausal women don't necessarily know that they're suffering from menopause. They may come in and say, I'm having night sweats, or they may come in and say, I'm having insomnia, or they may come in and say, I'm having mood swings, but they don't necessarily come in and say, it's menopause. They don't do that. So
sometimes they make that connection, sometimes they don't. Sometimes they're coming to me because they're headaches, or they have joint aches, muscle aches, those kinds of things. And
where do you see the most?
I actually treat a lot of children and pregnant women.
Really? What do you treat children for?
Children, I treat the ones that have the chronic ear infections
Okay.
that we were talking about. I treat when they're really, really little, like issues like reflux and colic. And plagiocephaly is very common, where they have misshapen heads and they're trying to avoid the helmet. I see a lot of that.
Wow. And what about pregnant women?
Pregnant women, your body is going through so many changes, right?
And how?
Right. So pregnant women, your uterus is getting bigger and bigger this way, but it's putting a lot of pressure on your round ligaments, which are supporting the uterus, and then you have the relaxin hormone circulating throughout your system to help open up the pelvis for the baby to come through. But in the meantime, it's making all of your ligaments
all
really
your joints hurt.
All your ligaments really stretchy, so you can low back pain. And then because your belly's coming up like this, there's less space for your abdominal organs.
She sounds like a person who's been pregnant, doesn't she?
Yeah. So then you might have issues with reflux, and then your breastbone is coming up, and then that's going to impact the drainage of your body. So then you can develop swelling in your hands, swelling in your feet, carpal tunnel syndrome. So a whole bunch of things.
So you can make all of that better.
Yeah, we can help.
Everything better.
I don't know about everything.
It sounds like magic. I mean, it really sounds wonderful. I mean, it just sounds like there's so many different benefits.
It's a very gentle treatment too.
Yeah.
That's I think common difference between chiropractors. They use a lot of force.
Yeah.
My treatments, I don't use a lot of force.
Yeah.
And then I'll give you an example of when you go to the doctor and you say, I have upper back pain.
Right.
And normally the doctor would say, here, have some Tylenol or Advil. Maybe go see a massage therapist. But they focus mainly on the back, right? And it could be coming from somewhere else.
Absolutely.
So if I'm going to have you
Yes,
actually take your shirt right here, and you're going to pull on it really hard.
Okay. Let me avoid the necklace.
Yeah.
Okay, I'm pulling on my shirt.
So pull on it really hard. Where do you feel it?
On my neck.
Okay, and you pull a little harder. Where else do you feel it?
My shoulders.
Okay. So you could go to your doctor and say, I'm having neck and shoulder pain. But where is it really coming from? It's coming from here, pulling this way, right? You have fascial tension pulling this way.
Sure.
And so my job would be to find where the actual problem is coming from.
Okay.
And address that.
Okay.
So if you can free this up, then you go back and check the neck and shoulders, and then, I feel so great.
That's interesting. It sounds like every problem has an origin in the anatomy.
Yes. My work is very, very based in anatomy and how the anatomy is related to function. So if you imagine your leg, one leg is shorter.
Yeah.
Are you going to be walking evenly?
No.
No, right.
And you're going to have all kinds of
how
imbalances.
Structure and function are interrelated.
Yeah.
And so that's what I work on.
This is cool. This is really cool. I mean, these aren't things that everybody knows. I mean, they may have heard of an osteopath, but they don't really know exactly what that means. So, what is the most common menopausal symptom you see? We saw an herbalist, and she said it's hot flashes, hot flashes, hot flashes. So, what's the most common symptom you see?
I see a lot of headaches.
Headaches.
Yeah.
Ah.
And joint pain.
Yeah.
Yeah.
Okay. And are there any risks to osteopathic treatment?
So I tell people that they may react to a treatment, they may not.
Okay.
Some people, they might feel awesome after treatment, and other times they might have a day or two of soreness.
Okay.
It's kind of like doing a workout you haven't done in a long time, and you get a little bit sore for a few days before it eases off.
Or a really deep therapeutic massage where you just really feel it the next day.
So sometimes people experience that, but very commonly, people get up and they're like, I wish I could take a nap. Or they fall asleep on the table while I'm treating them.
I love things like that.
Yeah.
So, what if a person fails an osteopathic treatment? Let's say you have a woman with headaches. They're related to menopause. She undergoes a treatment. Is it one treatment, or are they multiple treatments at a certain frequency?
Everybody's different.
Okay.
So you might have one treatment and have an amazing response, and sometimes it might take a few treatments.
Okay.
And I can't give an answer because everybody is
You have to wait and see.
Exactly.
Wait and see.
Yeah.
And do you often work in conjunction with another professional, say a gynecologist or an acupuncturist or whatever?
I do, yeah. I feel like we're a healthcare team.
That's great.
And we should all be working together.
Yeah, we should.
And I think I love Eastern medicine as much as most Western medicine, and I feel like there should be a nice blend. And I like to think that I am that blend.
I love people like you because this is exactly what I teach. that we should all be trying to just benefit the patient and not make the patient feel like she has to choose.
Well, my goal is for you to get better and live your life so you don't have to keep coming back.
Yeah.
That is one difference, I think, between chiropractors and osteopaths.
You're trying to work yourself out of a job?
No, because there's always going to be somebody, right? But if you go to a chiropractor, they like to see you 3 times a week for how many weeks, and then once a month for the rest of your life, and that's not my goal. My goal is to get you better to a point of health. And then you go on and you live your life. And
I want to see you a couple times, and then I never want to see you again. So what you say,
if you benefit, then you can tell other people about how you benefited. And then,
That's right. So true. And I teach that whatever we say about menopause, we should follow it with the 2 words, for me. And that makes it clear that this is something that worked for you personally, and it's not what everybody should do, and it makes it clear that all women are different and they respond to different things. So, well, can you show us a osteopathic manipulative treatment? I'll be the guinea pig.
Okay.
Okay, see? Okay, I'm getting a treatment. Do you find that some people have more of a gift for it, or more people are attuned to it? I mean, in the medical world, there are some people who are just really natural surgeons who operate just beautifully, flawlessly. It's a beautiful thing to see, and it's a natural thing. And there are people who, they operate, but it's not as natural. It's like playing an instrument. Some people are just gifted, and some people work really hard at it. They all manage, but it's different.
Funnily enough, I've always been good with my hands.
Yeah.
I was giving massages to my parents when I was little. I painted growing up. I played the piano. And I went to medical school wanting to be a surgeon.
Really?
I did.
So did I. And I became a surgeon. I was great with my hands too.
But
my hands
then
were a
when I
mess.
found out osteopathic manipulation and how it benefited people and how it wasn't invasive, it just really resonated with me.
That's great.
So,
that's great.
Just do that.
I love hearing about people's journeys and how they ended up doing what they did and why something impressed them. And that's great. Okay, so I'm going to get ready for my treatment. Follow me. Okay. Okay, are we ready, Ariana, for us to just talk? Okay, so you can just start whenever you want.
Okay, so first thing I look at is how your spine is, and the lower part, a little bit tight there. I want to see how you're moving. So you just relax, I'm going to move you. Okay. There you go. So you twist better to the right than you do to the left.
My whole left side is a mess.
And you bend a little bit better to the left than you do to the right. And this is all tight.
I'm very lopsided.
But the actual spinal mechanics are usually that you rotate better to one side and you side bend better to the other side.
Oh, okay.
That's normal spinal mechanics. So what I'm finding is not that unusual. Okay, let me have you lay down on your back.
And I can do this with my clothes on? I don't even have to take my clothes off?
You can. Usually I have you take your shoes off.
Oh, okay.
But that's okay. So I'm going to have you bring your knees up. You're going to lift feet on the table. Lift your hips up off the table and back down and straighten your legs out. There you go. I'm going to go this way. And then we're going to see how your hips are moving. And then we're seeing how they're aligned. And so I see how your pelvis is aligned, and I compare it to your feet and your ankles. So this side is a little bit lower. The left
so my
side.
Left leg is longer?
Well, that's the appearance.
Oh.
So what happens is your pelvis is like this,
yes,
and it's a little bit rotated this way. So I'm exaggerating, but that's what we're finding. So if this side of your pelvis is lower, then this leg is going to appear longer.
Okay.
So that's what we're looking at right there. So you're going to bring your knees up again and feet on the table. So I'm going to have you gently bring your knees apart, and I'm going to resist you. Good. And relax. You can do that again with half that strength. And relax. And again. And relax. And bring your knees together. And relax. Again. And relax. And one more time. And relax. And you're going to straighten your legs out. And now we see if we made a difference here. And now you are even. So to me, what that means is your pelvis meets at the front, at the pubic symphysis. There's a bit of cartilage right there at your pubic bone.
Yeah.
And you had a little bit of a shear right there. So if there's a shear, then that's going to give the illusion of this rotating forward.
Right.
And what we just did corrected that shear, and so now your pelvis is even.
And how long will that last? Will I stay like that, or do I need to be aware that that will recur?
It depends on how long it's been there.
Okay.
If it's been there for a long time, our bodies have been compensating for that pattern for many months or years, right?
Yeah.
And so our bodies have a tendency to go back. But we're trying to recreate new tissue memory.
Okay.
So over time, if it's really acute, like it's been there a very short period of time, like it just happened, you tripped over something, then I correct it and then it's done.
Okay.
So it's just kind of depends. Okay. Another thing we'll do is see how your legs are moving here. So this side, this side is a little bit stuck compared to this side. Let's see how much more this side moves. And I'm checking a motion at the hip and sacrum. So what we're going to do is you're going to bring this knee up. We're going to bring it up over your hip. There you go. I'm going to have my hand behind you here. Going to add a little bit of compression. So I'm balancing from the knee to the sacrum, where your sacrum and pelvis meet. And then we're going to straighten that out. And then we recheck. See how much more that moves? It's a very simple maneuver. And that helps free up that connection. So we're going to do the same thing on this side, because you don't want to be lopsided. There we go.
I just thought my back popped like it does with a chiropractor.
But that's not what we're focusing on.
I know, but I pop a lot.
Yeah. Okay. So that's one thing that we do. I'm going to have you bring your arms down by your side. And then if you notice, this shoulder is a little bit more off the table than this one.
Yeah.
And if I move your shoulders, this one moves, this one doesn't.
Yeah.
And you said this is, yeah?
Yeah.
So your arms connection to your upper body is through your scapula, which is your shoulder blade, and your collarbone. So we want to focus on, now see how much more that moves? Again, we want to do that on both sides. There we go.
So quick.
Yeah. Okay, so a lot of times when people are talking about shoulder pain, they're pointing to this part of their body right here, and they think it's the trapezius muscle.
Yeah.
The trapezius starts at your neck, fans out this way, and goes down your back that way, right? But this point right here is actually a rib. So you have neck muscles attaching to your first and second ribs, and if your neck muscles are tight, it's going to pull up on the rib.
Sure.
And that's going to cause a tender point right here. So this is actually the point that they're saying is hurting, and they think it's their shoulder, neck and shoulder, but it's a rib. So just balancing from the elbow to that point right there. Relax that. How's that?
Good.
And the same thing on this side. So now if you look at your shoulders, this is a little bit lower and closer to the table.
Yeah.
And you have nice spring through there. And then balancing at the head. So this place is really important because this is where your neck muscles come and attach to the back of your head.
Oh, that feels so good.
And this is where your vagus nerve passes through. So your vagus nerve is part of your parasympathetic nervous system. It's part of your rest and digest system. And this is the one that allows you to relax. A lot of times we are in sympathetic overdrive. So you're running from the bear. You're constant stress mode, right?
Fight or flight.
Exactly. So if we can balance and get your fight or flight system to calm down some, and your rest and digest system to also be balanced, then that helps a lot with your moods, with your breathing. A lot of times we forget to breathe. And you also have a lot of lymph nodes. So I'm working on the diaphragm through here. The diaphragm is really important because it is not only your breathing muscle, but it has attachments to your low back. So some people who complain about back pain, if you treat the diaphragm, then you're treating those attachments in the back. And you also have a whole bunch of lymph nodes that go through here. So that's going to help with drainage for your whole system. That's moving well. That's moving well. Now take a deep breath. How does that feel?
Good.
All right.
It doesn't take long.
It doesn't.
Cool.
Quick example.
Kind of neat.
Yeah.
See, you knew.
So swing your legs around and let's see how you're moving now. Again. So now, doing the same test and see how much better you move.
Yeah.
To both sides. And even this is looser. So. All right.
Very nice.
Yeah, how do you feel?
So I feel great, and I thank you so much. And
You're
my
welcome.
viewers, thank you so much, everybody. I appreciate your coming. I hope you enjoyed this, and now you know that doctors of osteopathic medicine can do osteopathic manipulation and solve a lot of your problems. So if this appeals to you, check it out. There is a link in the descriptive section of the video that shows you how to find Dr. Banik. And so that's it for today. Please follow me on Facebook, Twitter, and Instagram, and I'll see you next week where we'll go even further in showing you more of your options. Bye!